Good evening and welcome to Smooth Health on the Drive. It's Zibi and Kaide here. We're joined by our special guest, Dr. Mirabel Wosu. We're speaking about the scourge of hypertension. Today, our guest, Dr. Mirabel Wosu, will be telling us all we need to know and more about hypertension.
That's right. And to be a part of our conversation, it's very simple. What you can do is reach out to us on the various platforms. I'll tell you the best part of this. The best part is you can catch us on YouTube. It's youtube.com/smooth 981 FM Lagos. And also send your messages to 0809 444 0981. And also, you can call the studio lines 0144899981, and WhatsApp comes to 0809 444 Plus, we're giving our first three callers and texters free vouchers courtesy Evercare. You know what? Let's just tell you who our guest is on the show today.
All right, Dr. Mirabel Nwosu is a consultant cardiologist with valuable clinical cardiology experience, including basic and advanced cardiac life support, management of cardiac emergencies, and basic interventional cardiology skills through the performance of multiple procedures.
And also, of course, she's completed her advanced fellowship training in interventional cardiology at Evercare Hospital. Also, she's done a lot of diverse work, basically, and this is why we have her here with us in the studio today. Good evening, Doctor.
Good evening, Kayode.
And Zibi.
And Zubi.
With an eye.
With an eye. Oh,
Yes.
okay.
Welcome. Good to have you here, Doctor.
Thank you for having me.
All right, so let's just dive right into it.
All right.
So for the listeners out there, I'm sure that a lot of people are wondering. We'd like you to tell us, what is hypertension and what are the main causes of hypertension?
Okay, so this is a very important, relevant topic, and some people may say, "Oh, I already know what is hypertension or what it is," but when you probe further, you discover that people don't actually know what hypertension is. So, what is hypertension? Hypertension is also high blood pressure. You have the upper, and one is the lower. One is called the systolic, which is called like the contraction blood pressure, while the lower one is called the diastolic, which is the relaxation blood pressure. So once you have a value of the systolic over the diastolic blood pressure greater than 140/90 persistently, that is hypertension. But for you to actually diagnose hypertension, it's not one reading. Usually you have to do it over time. You have to know how to take the blood pressure appropriately. We'll discuss that later.
Okay.
As well as, recording over maybe 2 minutes. And then you take an average of the readings. And then it has to be at least 3 different occasions before you can say somebody has hypertension or high blood pressure.
All right. Well, that doesn't sound cumbersome at all.
True.
So if you're out there and you want to break it down, you want to, get details about this, please send your questions into our doctor this evening.
All right, doctor. Why is hypertension often referred to as a silent?
Okay. The reason why it's called a silent killer is because it usually, I would say usually does not present with symptoms. Like if you have malaria, you have a headache, or, you have cough, there's something wrong with your chest. But a lot of people are walking about with blood pressures of 200/100, and they absolutely have no symptoms, not even a headache, not even a cough, not even anything.
Sorry, let me jump in there. You said 2/100.
Oh yeah, so you have people with really, really, really high blood pressure, and they absolutely feel fine.
But wait, what is the normal blood pressure supposed to be like?
So your blood pressure should be less than 140/90. So you actually have some kind of classification. So the optimal one, the one that we strive for, should be at least less than 120/80. But then you have what they call stage 1 hypertension, where you have the blood pressure ranging between 140 to 159, the upper one, and the lower one is 90 to 99. Then severe is greater than 160.
Oh, wow.
And then the lower one greater than 100. But then you have this in-between borderline that is above 120, but not up to 140. It's called like a pre-hypertension. And the reason why that is important is because if you fall into that category, you don't just relax and say, oh, everything is okay. That is the time to begin to work on yourself so that you don't get to the point where your blood pressure is actually above 140/90.
All right, thank you so much for that, doctor. Once again, 01448998 is the number to call to be a part of this conversation. If you are at the moment maybe experiencing some form of hypertension, or you know someone that's going through that situation, you can also call in and let's have that talk. So, doctor, we've talked about the main causes and the stages, and you've also explained to us why it's referred to as a silent killer. But more importantly, we would like to know the signs, the symptoms, and yeah, even the stages now.
Yeah. So in a lot of people, as I said before, you may not have symptoms, but then, however, in some people, they may have symptoms. So the common symptoms will be things like headache, feeling of heaviness in the head, feeling of heaviness around the eyes. And then another thing is that a lot of people may manifest with the complications of hypertension. So usually they will present with the end stage or end organ damage. So they may come in with like stroke, and they may not even know they've had hypertension until it's that stroke that brings them to the hospital, or coming with kidney failure.
Wow.
Yeah, that's the thing about hypertension. So it is something that people have to recognize on time and realize that, oh, even if I have this hypertension, it is not like a death sentence. It's something that can be treated. But the symptom can range from nothing to headache to symptoms of the complications, which
Okay,
we'll
so
talk
those are the
about.
symptoms,
Yeah.
but what are the signs? Like, what are the physical signs? Like, if I see a person right now, how can I tell that this person is hypertensive? Is
So
there
there's
like
no way that you
there's
can't,
no way?
it's not by looking at, it's not like a stroke that you see somebody limping along the road and you say, oh, I know you had a stroke.
Okay.
A lot of times you may not see it, except maybe you are a doctor and then you are examining your patient and you may see some, touch, palpate the pulse of the person and feel something that may suggest, because blood pressure is all about what sometimes, so sometimes you may palpate, sometimes you may have some suspicion based on, but you, this person has hypertension without measuring the blood pressure. The only way to diagnose hypertension, you measure the blood pressure.
All right.
So, doctor, just curious about this. Who's more likely to be affected by hypertension or high blood pressure? Are there maybe specific age groups that are more likely to be affected, genders, things like that?
Okay, so in times past, it used to be a disease of older age. In fact, when you see hypertension in people of less than 18 or between 18 and 20, you'd be like, wow. But nowadays, anybody can have hypertension. You have hypertension in children. But I'm an adult physician, so I deal with people above the age of 18. So from 18 years upwards, you can have hypertension. So
Wow.
we've seen those kind of people. And usually, you talking about the types of hypertension, you also have what they call primary and secondary hypertension. Primary hypertension is the one that occurs in about 95% of people. And that's the one that usually there's really no, if my patients ask me sometimes, doctor, why do I have this? And I'm like, really, we can't really pinpoint any particular reason, genetic, environmental, the food you eat. So however, I wouldn't say that that's the, it's something that, can you categorically come out and say that is really relevant? It is, but it's still something you can't just say, oh yes, I agree with you, race is number two. So that's the thing about hypertension, especially the primary one, or essential hypertension, because there's really no cause. There's a familial thing, hereditary. If your parents had it, it's likely to pass, along generations and all that. But the secondary one is the one that occurs in, about 5 to 10%. And that's the one that there is a particular cause. And when you treat the cause, the hypertension goes away.
All right. Thank you so much for that, by the way. We see messages coming in. We're going to get to your messages as quickly as possible. Also, if you're out there and you want to call the studio lines, once again, the number to call is 0144899881. We're giving our first 3 callers or texters vouchers, courtesy Evercare Hospital. Here's a message from Aisha Atilala.
All right. Aisha says, good afternoon. Please help me ask the doctor why there seems to be an increase in the number.
For all these things, either drugs or non-drug treatment. So it's not a death sentence at all.
All right. Thank you so much for that, Doctor. Tell you what, let's go on a quick break. When we get back, we'll do some more talking. If you just joined the show, by the way, this is Smooth Health on Smooth 98.1 in Zibi and Kade. Today, we're discussing hypertension.
Smooth health on the drive.
Excuse me, let me just.
So should I put a stop?
Powered
No,
by
no, don't worry, let it
Evercare
roll into.
Hospital.
Let it roll into.
Pump up the volume.
Healthcare
Yes,
in
that's totally
Nigeria.
fine. I thought there's supposed to be an ad here. Why is it not?
I can't see any of that. I think there's an ad.
Now you've been served.
Okay, there isn't. Okay, oh well. Okay.
But there's no outro. The outro is here.
So this is the outro. Oh, there isn't?
No.
Oh wow, that's what you're saying.
Yeah.
Smooth out to the.
No, there it's zeroed out.
Okay, let me go for the glitching.
Okay.
Thank you.
Are we going back?
Yes, we're going back now.
Oh, okay. Was that okay? Is that
It was
oh.
perfect. You've been doing it for like 16 years.
you?
I'm serious now. Jen, bring us back in.
This is Miss Eva Johnson, and don't you touch that guy.
Welcome back to Smooth Health on the Drive with Zibi and Kayode. We're talking to Dr. Mirabel Nwosu, talking about hypertension, a silent killer. She's a consultant cardiologist with massive experience in the area.
That's right. And don't forget, guys, we're taking your questions and calls. So 0144899981. Now, Doctor, just before the break, we've talked about quite a number of things. We talked about, the age groups that's affected by hypertension, but now we'd like to know the risk factors. Because, we say, we've talked about how it's a silent killer, right? But then again, what are the risk factors? What should we be aware of?
Okay, thank you for that question, Coyote. So it's almost like chicken and the egg. So hypertension is part of the cardiac risk factors, and you have cardiac risk factors that also are associated with hypertension. So it works both ways. So the cardiac risk factors that are associated with hypertension are diabetes, obesity, sedentary lifestyle, high cholesterol. All these things usually are or may or may not. Even there's an entity called sleep apnea. That's also associated with hypertension. So, but hypertension itself is one of the most common cardiac risk factors. When things like stroke, which nobody wants to have, or things like heart attack, things like that, or heart failure, because hypertension, there are some particular organs that having persistently elevated blood pressure affects in the long run, which we'll go into probably later.
Okay, doctor, what are the complications of uncontrolled cases of hypertension?
Okay, thank you for that, Zubi. Very, very question, because I think once people realize that it's not just about, oh, I have hypertension, the main reason why we're making a fuss about it is because of the fact that untreated, undiagnosed, persistent hypertension can cause what we call end organ damage, which means that the following organs are likely to be affected. Number one, the brain. Stroke is one of the number one. In fact, there's no week that passes without somebody having a stroke. It's so common. And hypertension is one of the commonest risk factors for stroke. So the brain is one of the organs that are affected in terms of complications. The second organ is the heart, of course, because a lot of things, the heart can fail, it can be enlarged, it can be blockage of the vessels, blood vessels supplying the heart attack. Number three is the eyes. So the eyes, can be affected and can actually ultimately lead to blindness if not well, treated on time. Number four is the kidneys. The kidneys are one of the organs that persistent, uncontrolled hypertension affects. You see people sometimes on TV or radio saying, oh, I need dialysis. Oh, and a lot of times it's because of the fact that blood pressure has been untreated, for a long time, and then has finally shut down the kidneys, and then the kidneys don't work and they need dialysis, and obviously they need renal transplant. So it's because of these complications that we always we're very serious about. We need to control hypertension. We need to bring down people's blood pressure to normal.
Oh, wow. Okay. Well, sounds like a very, very, very heavy something.
Okay. Yes, it is.
But if you just joined us, we're also streaming live on YouTube. Please get your questions in there. It's youtube.com/smooth981FM Lagos. So talking about, uncontrolled complications, let's also talk about healthy lifestyle. Our choices and things we can do generally to reduce the risk of hypertension.
Okay. So it's all about trying to reduce, your cardiovascular risk. What are those things, we want to do? I mean, we all kind of know them. It's just that we have to keep being reminded because they're not easy to do, but they are necessary. I'll put it like that. So we have to know our numbers. We have to make sure we know our blood pressure numbers. We have to make sure we get regular checks. We need to know what our cholesterol is
Sorry to
like.
cut you. So what numbers are we to look out for? What are the numbers to, and how do you measure the numbers?
Exactly. So that's a very good question. So I would advise that a lot of time, a lot of people, if you suspect, you should, at least for the first time, for the first diagnosis, you should actually go to the hospital and see a doctor and let the doctor measure it. But even if you're at home and you have these electronic blood pressure monitors, I mean the good ones, not the other ones, you can actually measure it yourself. You must make sure, number one, that you haven't had any stimulant within the 30 minutes, 15-30 minutes of you taking your blood pressure. You're not talking, you've gone to you've emptied your bladder, you're not in pain. You sit down comfortably in a chair, your back must be rested, your feet must be planted on the floor, not your legs must not be crossed, and you're sitting straight, and your blood pressure monitor is on a table that is almost at the level of your heart, and there's a cuff. The cuff is what you wrap around your arm, and the cuff should not be too tight or should not be too loose. It must be an appropriate size. And then once you tie the cuff around your arm, at the same level, your arm must be on the same level as the blood pressure monitor. And then usually they're very easy. You just press the button and it measures the blood pressure. Usually you discard that first one because you're a bit anxious and no matter what happens, and then you take the second one and the third one, and the average of the readings is what your blood pressure is.
When you say arm, are you talking about the left arm or is the right?
So you can do either one. So when you're starting out, like in the hospital, when your doctor sees you first, usually we measure both. Once we measure both, there's a reason we do that, and that's because there are some diseases that can, cause abnormal readings between the two. They shouldn't vary by too much. If they do, there are some things that could be responsible for that. But if you are at home, the reason why you measure both is because you want to know the one that is higher, and that's the one you're going to use henceforth as your the arm that you're going to use to measure blood pressure all the time, because that's the one that's higher. There's always one that's higher, whether it's the left or the right. But the doctor is just to determine the difference, whether the difference is too much or not.
All right. Thank you so much for that, doctor.
All right, doctor, what are the possible lifestyle choices that individuals who are living with hypertension could adopt?
Okay, so let's start with diet. So diet is very important. There's a diet called DASH diet, dietary against. Dietary. I can't remember but it's a diet that is like based on the Mediterranean diet, and it's supposed to help in terms of stopping hypertension.
Okay.
So the most important thing for us in terms of blood pressure is salt, because the kind of blood pressure that we have is salt sensitive blood pressure, and we retain a lot of water, and water attracts salt. So you want to make sure that your salt intake is drastically reduced. A lot of times people mention 2 grams, 6 grams. Sometimes it's difficult to measure. What I usually would say is that a teaspoon, that is heaped, you level that out. That should be your intake of salt for the whole day. You shouldn't go above that.
Day.
Yes, for the whole day.
Okay, so now that you mentioned intake of salt,
Yeah.
now I've seen this with some older people.
Yeah.
Right. So some of them don't take salt
Yeah.
at all, because they'll say that because of their hypertensive nature
Yeah.
and diabetes. So would you also recommend that for younger people that are experiencing some form of hypertension?
Yes, it's for everybody that has hypertension,
Okay.
whether old or young. The way we've kind of moved away from saying old or young, because like I said, you have people in their 20s with hypertension. So
Yes.
once you have hypertension, even before you have hypertension, I think it's not a bad idea. I think we eat too much salt. We eat way too much salt than we need. So low salt diet is important. Fruits and vegetables are very important. Then of course exercise, aerobic exercise, at least 30 minutes every day. total of 150 to 300 minutes of exercise every week you should aim for. And then of course alcohol has to stop. Cigarette smoking has to stop.
Okay.
Taking of illicit drugs, cocaine has to stop. What I must point out something that people are not aware of. There's some medications that people take that can actually cause hypertension in the long run, like steroids,
Okay.
steroid medications, oral contraceptive pills, non-steroidal anti-inflammatory drugs. Examples: ibuprofen. Persistently, not only can they cause the gastric bleeding and all that, they can actually lead to hypertension. So these are things that are important, and you should be careful about the prolonged use of these kinds of medications too. So people should just stop smoking, no alcohol. I mean, if you're people talk about low, reducing the alcohol. Oh, doctor, I heard that a little bit of alcohol is good for the heart. If you're not drinking alcohol, don't start drinking. That is not good for the heart.
Well, no, because and it's good you mentioned that, because we've heard on various, well,
Yeah.
not by doctors now, but we've
Yeah.
seen in various platforms, they say a little wine is good for the heart.
Exactly.
Every wine is good for every meal.
Yeah.
That kind of thing. So
Yeah.
you're saying generally now.
So I would say to somebody who is a teetotaler, who is not drinking, don't start. Don't say, oh yes, let me start drinking. No. But if you were somebody that was drinking a lot, then I would say just reduce drastically to just like a small, wine glass, not brandy, not shots. Yeah.
Okay, let's talk about treatment options.
Okay.
So what would you recommend for individuals living with hypertension?
So, like I said, the treatment options also encompass, because these things I mentioned, this non-drug therapy, are actually very important, because if you just jump right into the medications and you're just eating anything you want, not exercising, living any unhealthy, it may not impact in terms of controlling blood pressure, because it may still affect you in the long run. So I want to emphasize that the non-drug management is also as important as the drug management. Now, the drug management should be prescribed by a doctor. People should not do self-medication. Oh, my BP is high. I went to the pharmacist and I bought, this particular It has to be, my BP is high. I went to the pharmacist and I bought, this particular It has to be properly diagnosed, properly prescribed, because we as a race, we have some specific medications that are better for us than for the white population. But however, all these things will be, your doctor will talk to you. Usually it depends. We can start with one medication. Or it depends on how high your blood pressure. If it's really high, we usually will go into 2 medications or even 3 medications. So the point is that there is something to do. There's a drug to use. And once you use it consistently, then you will see good results together with the non-drug, therapy, lose weight, eat well, sleep well, very important, sleep well, avoid stress. In this Nigeria, it's hard to do, I know. But so it's very important. It's very,
All right. All right. Just before we let you leave, though, I'm sure that the listeners out there would like to know, where to reach out to you from. Yes.
Okay. So I am at Evercare Hospital, Lekki, 1 Admiralty Way, Bisola Durosimi Eti Drive, Lekki Peninsula, Scheme 1, Lekki, Lagos. Website www.evercare.ng, and the telephone number is 0813-985-0710. And email is info@evercare.ng.
All right. So the good people of Lagos listening to the show, if you want to reach out to the good doctor, Dr. Mirabel, here with us, you can reach out to her, of course, via the Evercare website, which is www.evercare.ng, or you can just simply call the Evercare number, which is 081-398-50710, and also send an email to info@evercare.ng. Doctor, just before we let you leave, though, parting words, something for the people out there to hold on to.
Okay, thank you, Kayode and Zubi, for this very important discussion. So I would just say that we as Nigerians, we should know our numbers, get yourself checked regularly, know your cholesterol levels, know your blood pressure levels, know whether you have diabetes or not, just know your cardiac risk. And if there's any disease that needs to be treated, it should be treated appropriately to avoid complications.
All right.
All right, many thanks to you, Dr. Mirabel Wosu, for being with us on Smooth Health on the Drive.
Thank you for having me.
And that's it. Do stay with us. The Smooth Drive continues right here on Smooth 98.1.
Are we done?
That's it. We're done.
Wow.
30 minutes like a breeze.
Oh, there were not many